say that a woman comes and she had a pap smear and you find that there is abnormal cells in that area. What's the next step for that woman?
It depends. If it's an infection, you want to treat the infection and then repeat the pap smear.
Okay.
Many times by treating the infection, the pap smear will become normal.
Okay.
You can have a yeast infection, and that's a type of vaginal infection that will cause a pap smear to might look abnormal.
I see, I see. So, Robin, if a woman came to you for screening and she had a pap smear and it was abnormal, let's say she had an infection, what's the next step for her? Let's say we're dealing with someone who might not have health insurance, and so the person comes to the screening program. She has what turns out to be an infection. What's the next step for her?
We get the reports, the lab report, and then we are able to just treat her for the infection.
So you treat her there at the clinic?
Oh, yes. She's usually home. We usually call or send a letter, depending on what type of infection.
Okay.
It depends.
Okay.
But I usually call them, and then we treat them, and then they usually come back for a repeat pap smear in 1 to 2 months.
I see. So you treat them until, so the repeat pap smear tells you if the treatment has been working.
Correct.
Right.
Okay. Let's say then it is more significant than an infection. Let's say the woman, now we want to talk about cancer of the cervix. And first, Dr. Chung, are cancers always staged? I know radiologists always look for to determine what stages. Are the cancers always
staged? It helps in determining what the prognosis of the cancer is, as well as to determine what kind of treatments a cervix or any other cancer can be offered.
If the person has cancer, describe the stages to me first.
Well, first, I think what would be important is to describe what cancer of the cervix is.
Okay.
Cancer of the cervix is a problem that affects, it's cancer that affects the cervix that affects approximately 15,000 women per year in the United States. It is the second most common gynecologic malignancy in women. It is a highly treatable cancer. The staging of cervix cancer, as seen on the screen, is basically classified from stage 1 through 4.
We have approximately 15,000 women per year are diagnosed.
In the United States.
In the United States,
Right.
okay.
So the staging of the cancer is defined from stage 0, 1, 2, 3, and 4. And it is determined by predominantly what the extent of the disease is that is present in the cervix. There are important tests and exams that are done to determine what the stage of the cancer is.
Okay, so we have these various stages, and depending what is done depends on the stage. So Dr. Rutherford, start with stage 0 for me and tell me what you would do. Tell me first, stage 0, what happens to this woman?
Stage 0 is not an invasive cancer.
Okay.
It's a pre-malignant disease to where the cervix is undergoing changes that, if not treated, may or may not turn into cancer. We use a designation called CIN1, CIN2, and CIN3.
Okay.
And what that means is this. All cells that in our body start on a basement membrane, and off of that foundation we build up layers. A CIN1 means that the disease or the abnormality is from the basement membrane 1/3 of the way up in the layer. And CIN2 is 2/3, and CIN3 gets the full thickness, or 3/3.
Okay.
Those diseases actually can treat by either freezing the cervix or lasering the cervix or just removing a piece of the cervix. A CIN1 lesion, or just disease in the lower third, 1/3 of those abnormalities go away by themselves.
Oh, really?
1/3 of the abnormalities are persistent, and 1/3 of those abnormalities will persist.
Now, you say 1/3 go away by themselves. So how does a woman decide whether to get treatment or not?
She doesn't.
If she's in that.
That's where we need the screening people and your doctor to look at this lesion and look at the pathology slides and determine what needs to be done. But a CIN1, the first time a woman would have a CIN1 lesion, we usually do not treat. We repeat the pap smear in 3 to 6 months.
I see. Okay. let's say someone came and she is in stage 1, which said it is strictly confined to the cervix.
Okay.
If a woman has cancer, cervical cancer stage 1, is strictly confined to the cervix, what do you do? First, who would tell her? If she came to your place and this is what is found, do you tell her or do you send her to the doctor or what happens?
In our practice in the Women's Center, yes, I usually refer her to a person or a provider who can do what is called a colposcopy, which is actually looking at the cervix with a microscope.
I see. So now it's beyond the Pap test.
It's beyond the Pap, right.
Okay.
So now I need a specialist to be able to do a colposcopy.
Okay.
Then that person, that provider, then becomes a partner with me. If this is a woman that knows me a little bit better than the provider I refer her to, then of course I could be in the room, I could be present. I feel more comfortable having the specialist explain it and be the person, because he or she's going to manage this person for treatment.
I see. What exactly is a colposcopy? What do you do besides looking at the cervix?
When someone has a colposcopy, it's like a big magnifying glass. That's all it is. We use a green light, and with that we can see changes when we stain the cervix to look more white on the cervix. The staining solution we use is just a vinegar solution. So it's the same white vinegar you use in your house.
Oh.
And we put that on the cervix. The faster the cervix turns white, the higher the degree of the dysplasia or the abnormality.
I see. So what do you do with someone who has...
If you have a grade 2 or grade 3 cervical lesion, like CIN2 or CIN3, we're going to treat that by either a laser cone, meaning we go in and we excise a portion of the cervix, or there's a procedure called a LEAP that they can do in the office.
A laser cone?
Laser cone, we do that in the OR.
Oh, and is that something a radiation oncologist would do, or is that something?
No, that still sort of stays with the
that's
GYN
still with
doctor.
the GYN
These are pre-malignant lesions.
This is all pre-malignant yet.
Okay.
Or we do a LEAP, we remove a portion of the cervix, or we can even freeze the cervix. And hopefully that will make, when the cells regenerate, the cervix come back normal. And then what we do is we go back to the screening portion of the protocol and allow them to screen to make sure the lesion doesn't come back.
Now, for a woman who has had this procedure, can she still have children? Will this affect childbearing at all?
The answer is yes, it can affect. If someone would inappropriately cut off too much of the cervix, you can damage the ability to carry a pregnancy, that they become preterm labor.
Oh,
but the whole key is not to do that. So if the procedure is performed properly, that should not be a major issue.
Okay. Do this, you cut off this lesion and you treat the person, and then they come back to Robin again for another...
Correct. They would be followed by Pap smears.
For another Pap test.
Right.
Okay. Suppose, how often do they have to go back for a Pap test after this procedure has been done?
Well, nobody really knows what the right answer is, to be honest. But what
do you recommend?
What we recommend is for the first couple years that the Pap tests are more frequent. And it's somewhere between 3 to 6 months.
I see. Okay. But normally we just have to have a Pap test once a year.
That's
right?
correct.
Okay. Let us then talk about the woman who has a more advanced stage. And again, we want every step of the way to encourage women to have these tests. Don't let your Pap smear go for 3 years without having it, because the earlier the stage when we can identify something is going wrong, the more effective the treatment can be.
That's correct.
Is that so? Okay.